Hi all, it's Dr. Nick here. Today I want to talk about what would happen if you were to unfortunately roll your ankle on the course and you're unable to continue the race. First, I want to make this perfectly clear. Injuries can happen. It happens to elite athletes, it happens to weekend warriors, it happens in everyday life. So unfortunately there's no real way to fully prevent an injury. And today I want to talk about probably the most common injury out there, which is a lateral ankle sprain. A lateral ankle sprain is the most commonly injured body part in physically active individuals. They're also very common in general populations as well, and they can happen more frequently once you have had one. The mechanism occurs when your ankle turns inwards with a bit of force, and if your ligament isn't capable of handling the stress of that motion, then it can be damaged. The ligament that's damaged is called your ATFL, or your anterior talofibular ligament, which attaches your fibula, which is the bone on the outside of your leg, to your talus, which is your ankle bone. Now, if you're out on the course, this could happen in a number of ways. You could be landing down from a ridge, you could be running and the terrain is a little slippery or the terrain's a little uneven, and you just catch, a stump or a rock or something just that perfectly. And that's one of the main ways it could happen while you're out running an obstacle course race. Now, if this happens to you, first off, don't panic. And people might jump and want to just run to the emergency room and get an x-ray and get it looked at. But there's a little trick that you can use to avoid all that. They're called the Ottawa ankle rules, and they are used to determine whether or not you might need an x-ray after you roll your ankle. It comes down to this. If you have pain while you are pushing along your medial or lateral malleolus, which are the two bones along the outside of the ankle, or if you're unable to take more than 4 steps with that ankle, chances are you might need an x-ray, because then it might be broken. However, if you don't have any of those symptoms, so no pain at those 2 points, and you're able to walk on it afterwards, then you might be able to avoid getting an x-ray, which saves you a whole lot of time, money, resources, and also, gets that, out of your head a little bit mentally, that, things may not be as bad as you think. So say this happens. You're out on a run, you're running your race, you step wrong, you roll your ankle. It's probably not broken. Great. Now what's next? Now we give it a little peace and love. Now, I've covered this before in a previous video. Peace and love is replacing RICE, which is rest, ice, compression, and elevation, which is outdated in today's world. Now, if you haven't seen that video, go back a couple weeks and check it out. It's on my page right here. But I'll cover it real quickly here in this video. So, this is what you do in the first few days after your injury. P for peace, protect it. Try not to make it worse. E is for elevate, so keep it up above your heart. Let gravity assist with draining the swelling. A is for avoiding anti-inflammatories, so no NSAIDs, no ice, because that's going to delay the process of inflammation, which is what we want, because inflammation is part of the healing process. C is compression. That's going to force fluid from that distal segment up back towards your heart as well. Ties in really well with elevation. And then E is for educate. So providing this information, being like, it's going to be all right. This is the next steps we need to take. Now, after those first few days, now we're into the love portion of it, which is L for load. So get some pressure on it, put a little more weight through that foot. O is for optimism, because your outlook is going to affect how well and how quickly you recover as well. This isn't just your attitude, it's beliefs, it's these intrinsic things that, push you in the right direction. So having a positive attitude is huge. V is for vascularization, which means let's get some blood flow into the area, which the best way to do that is E with exercise. Now, if you're just starting off in your injury recovery, this exercise can easily be something cardiovascular in nature, such as an elliptical, riding a bike, a rower, something that's lower impact, but it's still going to stimulate blood flow in your joints and into your muscles, which is what this injury is going to need early on. Now, when you have a lateral ankle sprain, like I mentioned earlier in this video, you are at risk at developing another sprain at some point, and that's due to chronic ankle instability, which is exactly what it sounds like. That ankle just becomes, a little bit wobbly since that ligament's always going to be a little loose. Now, the best way to start preventing that is by strengthening that ankle and getting it mobilized. And one of the best ways to get it mobilized is with this banded dorsiflexion mobilization, which you can see here. So what you basically do is you take a little thin band, you loop it around each bone in your ankle and directly below it. If you can elevate that foot a little bit, that gives a really good vector to go backwards and allows that mobilization to be a little bit more effective. But you can do it from the floor as well. And basically all you do is you drive your knee forwards over your toe. If you need a little bit more resistance, add a weight on top of that knee and push that knee a little bit more forwards. Another thing that's really important to do is to restore proprioception. Now, what is that? That's a fancy way for saying knowing where that joint is in space. So if you think about driving for a second, you don't need to look at your foot and ankle everywhere you go to move from the gas to the brake. That's proprioception. You know exactly where that ankle is going. Now, for someone with a sprain, those proprioceptors are damaged and irritated a little bit. So being able to restore that is important for natural movement and mobility. One of the easy ways to do that is balance. So standing on one leg to start. Don't add any movement initially, but after a little while, we want to be able to challenge that foot and that ankle. So adding some single leg movements, such as deadlifts, single leg squats, lunges are going to be really important to challenging that ankle and that stability. Also important to work in as many different planes of movement as possible. When you're walking, you normally just go straight up and down, but if you're running on an obstacle course race, you need those stabilizers along the inside and the outside of your foot to be working, not just in your foot, but also into your knee and into your hip as well. So that's another reason why single leg work is great for ankle sprains, because it's not just going to challenge your balance and those proprioceptors in the foot and the ankle and the area that damaged, but also everything above that ankle as well. It's going to provide that support and stability and security as well, so that you can get back on the course as fast as you can and prevent the injury from happening again. Now, we don't want to forget specific ankle strengthening as well. There's a lot of different muscles that cross the ankle and work on the ankle. So hitting all of those muscle groups are going to be really important. So for example, a post-tibialis raise, where you're squeezing those ankles together and facilitating that inner portion of the quad called your post-tib. Your everters along the outside of the ankle, which actually helps support that lateral stability. That can be a neglected muscle group. And then, of course, your calf muscles. There's two major muscles in your calf: your gastroc, which works with your knee is straight, and your soleus, which works when your knee is bent. Now, your soleus can be a little bit undertrained, so it's important to hit both muscle groups. Now, this doesn't just mean do 1,000 calf raises at the end of your workout. Get some load on them, train them like any other muscle. The last step when recovering from an ankle sprain is developing landing mechanics, jumping, and plyometrics. So being able to leave the ground quickly, being able to handle that load as you come down, and do that safely. This takes a lot of force and a lot of effort. So make sure you're working with either your PT or your trainer is giving you appropriate progressions and not neglecting this area. So just to recap with an ankle sprain, you may not need the x-ray. Don't baby it. Don't ice it. No anti-inflammatories. Give it a little peace and love. Get it moving. Get it mobilized as best you can. And make sure you talk to a professional about this as well, because they're the ones that's going to guide that plan and get you back on the course as quickly as possible. So thanks for watching. Don't forget to like, subscribe, share this video to someone who may find it useful, and I'll see you on the course.